Good afternoon, everyone. I want to start by saying something to you that you probably don't hear often enough. Thank you. You are providers of what I believe is the most critically important service and innovation delivered in our world today. And you are doing your work in an environment that is in a state of constant change, ongoing budget recalibration, and constant criticism from people who have never done the hard work that you do every single day. So thank you. As we take a peek into the future, I want to take a minute to consider what is up your sleeve. When you look at your wrist, do you get the current time, the number of steps you have taken so far today, or your heart rate? Okay, mine's racing a little. This is the time when more and more we are in charge of our own health and the health of our sector. We are all part of the start of a movement that will change healthcare delivery, dramatically affect the populations of whole nations, and improve the quality of life for people in every longitude and latitude throughout the world. And it begins here and now. This is a very personal business. And this and the other devices and technologies that we use every day don't make it less so, but more so. There is a convergence of forces that are bringing about the personalization of health in new and meaningful ways, and a much greater focus on well-being. Today, I want to look at the top 4 trends that are happening that are influencing this move to personalization. The first is the advancement and proliferation of personal connected devices. Second, the consumerization of health. People are becoming much more demanding about the services and the quality of the services that they are receiving. Does this sound familiar? Cost is third. But it's not just about the money. It is about the toll it takes on each of us and on our loved ones. The astronomical cost of a chronic illness and the impact it has on the quality of our daily life. And fourth, the convergence of genomics and connected health, a move towards precision medicine, or as a die-hard public health professional like me likes to call it, precision health. This is not just an opportunity, it's an imperative. If we have the means, we must find the way. We each have an incredibly important role to play. And if we choose to lead this movement together, we will not only do good, but we will do well. So let's take a look at this new healthcare consumer, that demanding new force in the industry. These consumers have more information up their sleeve. There has been a proliferation of devices that monitor everything from sleep to diabetes to steps to calories, heart function, and brainwave activity. These are not just gadgets. They are mechanisms to deliver better health outcomes. We now have studies that demonstrate that diabetes monitoring helps improve outcomes and reduces cost, that sleep analysis changes habits and increases well-being and productivity, and brainwave tracking yields strategies for reducing anxiety and depression. So how do we get smart about using all this information that consumers are carrying around with them? This is an area that really needs work. And if we seize the challenge, it is a huge opportunity for both change and for profit. The solution is not a straight line. There must be a greater focus on standardization and certification of products already in the market. And there needs to be acceptance that this data is useful to providers, both in diagnosing problems and perhaps, and more importantly, in engaging people to become an active part of their treatment and restoring their own good health. This is not the only example of technology disrupting business as usual. In every aspect of our lives, technology has radically changed the way that services are consumed and delivered. Take banking, for example. Branches are closing every day. ATMs are being replaced by mobile phones. And the teller has become the willing listener in the call center. Groceries are being delivered to your door within 2 hours of a few clicks and taps. Uber is there in a minute, and it's already under threat from driverless cars. But too many healthcare habits are frozen in time. As much as consumers want good care, they don't really know what that looks like. They do not see themselves as primary sources of their own personal information. And in particular, when they're communicating with their physicians or the person most responsible for their own good health. Our job as a sector is to recognize where the consumer is, and that means all of us as consumers, and help shape the transition from a passive, patient-centered approach to one that is patient-driven. Continuing to have a disconnect between health services and every other one that we use as consumers is unsustainable, and we can play a critical role in changing that. I don't want to be the 100th person this week alone that has reminded you that cost is an issue. But it is. There are several dimensions to how technology can keep costs down at critical times in a person's life. We'll just take a look at diabetes. Diabetes is a domino disease. Once started, it takes away aspects of a person's health, leading to amputations, kidney disease, heart failure, and wipes out dollars in rapid succession. Today, 30 million Americans have diabetes. Another 86 million are pre-diabetic. The collective health care costs is $322 billion per year. This is 1 in 5 of the dollars spent in America on healthcare. Let's just take a moment to think about that. And by the end of today, another 3,830 people will be diagnosed as diabetic. This should scare all of us. It certainly scares me, because we're all at risk. What does give me real hope is that technology doesn't lie, and it can provide real truth in real time to real people who need information to keep themselves from becoming a statistic. Weight, exercise, diet, all things that technology can monitor, and all data points that can motivate healthy behavior, prevent disease, and save lives. And you know what? It's a lot cheaper than the treatment. But how do we get that information to be actionable beyond the wrist? It's critically important to combine that information with other health-related information. While 50% of people who buy a fitness tracker stop using it after 6 months, we believe that if that information had someplace to go beyond the device user, it would continue to be worn, and it would become a meaningful part of a person's life and health. Now, the reach part of this conversation has to do with genomics and precision health. The advancement of genomics has been faster than we ever could have imagined. And the implications for prevention, diagnosis, and treatment is astounding. It is literally beyond the scope of our imaginations. Let me share with you something that has rocked my world. I have a young colleague who wanted to know where she came from. Not the kind of question that is usually answered by embarrassed parents, but rather she wanted to know her ancestry. So she spit in a tube, sent it off to 23andMe, and back then, the test automatically included not just ancestry, but genetic health information. She learned that she was at an elevated risk for a rare genetic condition. And so she went and talked to her doctor about that. And the tests revealed that, in fact, she had it, but that it could be treated easily and cured easily through a minor surgical procedure. She had the surgery and is living a full and healthy life today. Had she not, she could have died young of a preventable but otherwise hidden condition. This is not Star Trek. This is the path that medicine and preventative care must take. And we are learning new information every day that will move us forward to realizing the promise of truly personal health. 4 trends that translate into an ambitious vision for rethinking health and for our work at the Personal Connected Health Alliance. Our focus is on making staying healthy or restoring health an easy part of everyday life. And the way that we do this is by providing a platform for setting a collective vision of the future of health and mobilizing collective action to get there. We have several initiatives we are working on now, but I want to take one of them and walk you through what is happening and why. Aging. It is happening as I speak. To all of us. Aging, from now on, should really be looked at as healthy longevity. And as Joanne Jenkins spoke about this morning, what we really want to do is to grow older healthier and to live longer healthier. That is the goal. We prioritized healthy longevity because we felt that if we acted on the 4 trends I just spoke about, we could transform how we approach issues related to aging. This includes moving beyond lumping all people above the age of 65 into one big old basket. Instead, we need to adopt a more personal approach. And we believe that we're going to come out with some really meaningful outcomes if we do this in this work on healthy longevity. Like staying in our homes and out of the health system and assisted living facilities. Lengthening our productive lifespan and increasing our contributions to society. And reducing mental health issues that stem from isolation and the stigma attached to aging. So let's overlay these opportunities and the 4 trends: the proliferation of personal connected devices, the consumerization of health, cost, and precision health. Everything from home sensors to FaceTime to remote patient monitoring devices has the potential to keep older adults connected to the rest of the world. Studies bear out the value of social contact as we age. Couple that with the power to remotely monitor health and deliver health services. Technology can ensure that people who are not as active are not invisible and can maintain their health and well-being. As consumers, the aging and their families are looking for ways to interact across generations and with the health system seamlessly along the lines of current consumer trends that are harnessing the power of technology. And cost for those on a fixed income and their families is especially important. And the burden of caring for a sick family member and the toll it takes on the individual is a problem we will all face at one point in our lives. Preventing serious injury and chronic illness does not just save money. It preserves quality of life for those involved. And finally, we take all of the opportunities and the data available and the promise of precision health and apply them systematically in a way that reshapes how we live healthier longer. We need to stop talking about populations, demographics, and disease profiles, and instead talk about people. And by people, I mean ourselves. The reality is that you and I and you and each of the people that you are sitting next to, we are all going to age differently, and we are all going to want to age differently. So what do we do about that? We work together to create the vision for personal connected health. What does this look like? It's a combination of a genomic health record, a personal health record, plus all of the data from all these personal connected devices brought together to complete the health puzzle that is each of us. And you know what? It sounds hard, because it is hard. But it can happen for our tomorrow if we all work together today. It's time for all of us to use the information at hand. What you know is incredibly valuable and can shape the future of healthcare and change lives for generations to come. As we work to define personal connected health and advance the movement that has begun, I hope that the connections that we have already made will be made even stronger, and you will become an even more active part of the work that we do at the Personal Connected Health Alliance. Consider this an open invitation. Thank you.